Understanding and preventing prediabetes in Black women. Prediabetes is a condition that often precedes type 2 diabetes, characterized by blood sugar levels that are higher than normal, but not yet high enough to be diagnosed as diabetes. For Black women, understanding the nuances of prediabetes is crucial, as this demographic faces a disproportionately high risk of developing type 2 diabetes compared to other racial and ethnic groups. By shedding light on the causes, risks, and preventive strategies, Black women can take proactive steps to safeguard their health. Black women in the United States and other parts of the world are more likely to develop prediabetes due to a combination of genetic, social, and environmental factors. According to the Centers for Disease Control and Prevention, CDC, more than 96 million American adults have prediabetes, and many are unaware of their condition. Black women, in particular, face unique challenges related to healthcare access, socioeconomic disparities, and cultural influences on diet and lifestyle. These challenges often exacerbate their risk of developing prediabetes and progressing to type 2 diabetes. Prediabetes develops when the body becomes resistant to insulin or when the pancreas is unable to produce enough insulin to regulate blood sugar levels. Several factors increase the risk for Black women, including genetics and family history. Black women with a family history of diabetes are more likely to develop prediabetes. Genetic predispositions can affect how the body metabolizes glucose and responds to insulin. Dietary patterns. Traditional diets in the Black community, while culturally significant and flavorful, can sometimes be high in refined carbohydrates, fried foods, and added sugars. These dietary choices contribute to weight gain and insulin resistance. Obesity and weight gain. Nearly 80% of Black women are overweight or obese, a condition closely linked to insulin resistance. Excess fat, particularly around the abdomen, increases the likelihood of developing prediabetes. Physical inactivity. Black women report lower levels of physical activity compared to other groups, often due to barriers such as lack of time, unsafe neighborhoods, or limited access to fitness facilities. Chronic stress and discrimination. The cumulative effects of stress from systemic racism and discrimination can lead to chronic inflammation and hormonal imbalances that contribute to insulin resistance. Polycystic ovary syndrome, PCOS. PCOS, a condition that disproportionately affects Black women, is another risk factor for prediabetes due to its impact on hormone regulation and insulin sensitivity. If left unaddressed, prediabetes can progress to type 2 diabetes, a condition with severe complications, including heart disease, kidney failure, blindness, and amputations. For Black women, the risks are amplified due to higher rates of hypertension and cardiovascular disease. Prediabetes is also linked to non-alcoholic fatty liver disease and an increased risk of developing certain cancers, such as breast and colorectal cancer. Beyond the physical risks, prediabetes can also affect mental health. Studies have shown that Black women with prediabetes or diabetes often experience higher levels of depression and anxiety, which can further complicate disease management. Early detection of prediabetes is critical to preventing progression to type 2 diabetes. Common signs and symptoms include excessive thirst, frequent urination, fatigue, and blurred vision. However, many people with prediabetes do not experience noticeable symptoms, making routine screening essential. Healthcare providers use tests such as the A1C test, fasting blood sugar test, or an oral glucose tolerance test to diagnose prediabetes. For Black women, it is especially important to request these tests during routine checkups, particularly if they have a family history of diabetes or other risk factors. The good news is that prediabetes is reversible with lifestyle changes and, in some cases, medication. For Black women, adopting culturally sensitive approaches to health can make these changes more sustainable and impactful. Healthy eating. Focus on whole, unprocessed foods, including fresh fruits, vegetables, lean proteins, and whole grains. While traditional dishes can still be enjoyed, consider modifying recipes to reduce added sugars and unhealthy fats. For example, swapping fried chicken for oven-baked or air-fried versions and using spices instead of salt can help make meals healthier without sacrificing flavor. Regular physical activity. Incorporating movement into daily routines is essential for improving insulin sensitivity. Activities like walking, dancing, or group fitness classes can be enjoyable and accessible ways to stay active. Black women should aim for at least 150 minutes of moderate-intensity exercise per week. Weight management. Losing even a small percentage of body weight, about 5 to 10%, can significantly improve blood sugar levels and reduce the risk of developing type 2 diabetes. Working with a registered dietitian or joining support groups can provide the guidance and motivation needed to achieve weight loss goals. Stress reduction. Managing stress is crucial for maintaining hormonal balance and reducing inflammation. Practices such as yoga, meditation, or therapy can help Black women cope with the unique stressors they face. Regular health checkups. Staying proactive about healthcare is key. Regular blood sugar screenings and consultations with healthcare providers can help monitor progress and catch any issues early. While individual efforts are important, systemic changes are also necessary to address the root causes of health disparities affecting Black women. Policies that improve access to affordable, nutritious food, safe spaces for exercise, and culturally competent healthcare providers are essential for creating environments where Black women can thrive. Community organizations and churches often play a vital role in promoting health education and wellness programs tailored to the needs of Black women. Initiatives such as group fitness sessions, cooking classes, and diabetes prevention workshops can empower women to take charge of their health while fostering a sense of community. Prediabetes does not have to be a precursor to type 2 diabetes, especially for Black women who take proactive steps to improve their health. By addressing the unique challenges they face and making small but impactful changes to their diet, exercise routine, and stress management strategies, Black women can significantly reduce their risk. However, tackling this issue also requires systemic change to remove barriers and promote equity in healthcare access. The journey to reversing prediabetes may be challenging, but it is a journey worth taking. Through education, community support, and a commitment to prioritizing health, Black women can reclaim their well-being and prevent the devastating consequences of diabetes.